I'm Bob Dempsey, and we're doing our periodic update on the COVID-19 crisis, which I think has obviously been the issue of the year of 2020. It's been quite an issue, and I think a lot of the events of the year directly relate back to this crisis. All of our jobs, all of our meals, all of our recreation, our families' ability to find jobs. A lot of social unrest. And I think they're all related. I think this is a particularly important period right now because schools are opening. And the question of whether they are open or virtually open is going to cause stresses in either direction. So I wanted to spend some time talking about that, putting in perspective where we are with COVID right now, where we hope to be, talk about things like vaccines, talk about the social unrest that the country and the world are feeling. And I think because I think most social justice comes back to health, and I think that way a lot, um, this interruption in our health and healthcare has been very much unsettling and brought out a lot of old wounds. The COVID numbers are really rather stunning. Realizing that we do not report all COVID cases worldwide, and there are reasons, inadequate testing, or a distinct desire not to report cases. And many governments do that because it makes them look bad. Many people in power do that because it makes them look bad. You have to understand that. And that includes hospitals. Hospitals don't want to be shut down or converted to a COVID unit. They often underreport. We know there are 25 million confirmed cases in the world. That is compelling. That's really impressive type numbers. And it compares to very few other pandemics that we've been dealing with in our lives. Some more infectious but less virulent disorders, such as influenza, certainly had more people, but not this impact. We think there are about 875,000 deaths worldwide. And in all pandemics, most of the epidemiologists kind of multiply by 2 or 3 to really try to get a look at that. And that's the numbers we get when we look at the increased deaths for these past 6 months compared to normal 6 months in any place where we've seen COVID. In the US, we have 184,000 confirmed deaths, and Wisconsin has been relatively spared, something like 1,130 deaths, which for proportion means that we have been spared the worst of the pandemic. It also means we're quite susceptible. These go on. Now, I draw a direct line worldwide to this re-evaluation of social justice issues. People will have different reasons in different areas, but when you take a population and you disable their usual defense mechanisms or cause increased isolation, these old grievances come out, and they come out strongly. They come out violently. And that's happening. Unfortunately, we predicted it here at these meetings, and it happened like within the week. It will continue, but it can be addressed. And the way we address it is what we do best, is that we try to get on with our lives as safely as possible, and we try to address the health part of social justice, which is worldwide, including right here in our own community. So if you talk about that, you gotta be proud of some of the things that we do as a health system, some of the things we do as a department, our program in decreasing stroke in the United Nations. Well, guess what? The most health needy group for stroke and stroke risk factors in the United States are the Native Americans. So we're thinking about these things. We are together working on them. And worldwide, we've been able to reopen a lot of our efforts with the Foundation for International Education. And we're doing it virtually, but we're started. And we're defining that worldwide and in the US, there are these remarkable online techniques that we can even intervene in ORs in Vietnam and around the world. So we got to use those so we can continue to improve health worldwide. What's happening now with the schools is fascinating, it's interesting, it's important to talk about because it seems to be as different can be everywhere you look. I think that the Madison criteria are important, and most schools seem to have had the desire to open in fact, and most schools have scaled back to some sort of hybrid. Some schools have said we're going to open as a regular school, and we're going to follow a plan which I'll outline shortly when I talk about UW, and within 4 days close down to virtual. That had to do with people not following the rules, which are pretty simple. They're use a mask, wash your hands frequently, and distance. And when they didn't distance, there were lots of cases. Now, it's important to know that many of those people are doing well now. Some are not. And the ones that are not, and these younger people, are usually not dying of pulmonary complications unless they had a pre-existing condition, but they are having a small number of disturbing periviral syndromes, which are common with these viruses, affecting their vessels going to kidney, heart, and brain. And so that's a major concern. Big athletes in football teams having inflammatory cardiomyopathies is not to be understated. Nevertheless, a lot of the new cases are not overwhelming the ICUs, and the deaths do continue, however, because the number of cases are greatly increased. So this is not sparing young people, it's just affecting them differently. And that's a way to think about it. The Madison Public Schools, I think, have a very interesting approach. I'm not going to say what's good or bad, but they're looking at reopening the very young children, which they felt both sociologically needed that socialization of schools, and they were hoping that they'd be less affected. But they begin to look at what are their parameters to open other ages and other groups. Right now, Dane County is averaging 42 cases a day. That's not deaths, those are cases. That's not ICU hospitalizations, but cases. That's a very low number compared to what's going on today in Spain or in the southwestern United States, for example. But that's our number. And they felt that we must, for 14 days, get the average below 39 cases a day. For 4 weeks. And then they'd reopen grades 3, 4, and 5. To reopen grades 6 through 12 for in-person instruction, not online or virtual, they wanted to see the 14-day average down from present 42 to 19 cases a day for a month. So you can see that this is, rather strict, and it's going to take a while. First of all, you have to achieve those low numbers, and second of all, you have to achieve them for 4 weeks in a row. They say if the cases go above 54, they may just close all grades to in-person instruction. I believe that today they opened instruction to children with disabilities in person, or people who had other reasons why they needed to be in-person instructed. But I think that's kind of compelling and kind of interesting because it sets parameters. They may be unrealistic, especially because the way you fight this disease is to test people. And it's going to be hard to get the numbers in this county below 19. But at least we know what the goals are. The university took a very different approach. They're very interested in opening, and I made an economic argument as to where they might want to do that because of the concerns of people not paying tuition for virtual learning, which they could get online in other facets. Of course, underestimating the value of a degree. but also because they wanted to do extracurriculars, and that meant having students on campus. These are real drivers. They really are, because some of those extracurriculars are financially motivated. You saw that the Big Ten canceled their football season, and I suspect it's because of bad experiences with some sports, but also an inability to make money on an expensive sport if there are no fans in the stands. But their theory is they want to reopen. They want to do small group in person, large lectures virtual, open all the dorms, but try to spread people out a bit, primarily around the gathering places at dinner, etc., cafeterias, and to test everybody in the dorms. They would be responsible for them. They would test an aliquot or a sample of all the patients to try to find out if there was outbreak within the school. And they would test anybody that wanted to be tested. It's expensive. It's kind of random, except for the dorms. And the dorms are going to be more crowded than they think. There have other people that have tried this and failed. However, if you're going to reopen in September of 2020, you have to do it this way. They also wish to do contact tracing and maintain social distancing. Let me just check their other things here. Modify the dining and regular testing of everybody. Not sure if it's going to work. I'm excited to see them try it. I hope it works, but we must respond if it fails quickly before we end up with a lot of people spreading disease. These are the reasons why we're still not traveling much. It's interesting that while the university wants people to travel here to Madison, we're pretty much banned from traveling elsewhere in the country for lectures, talks, etc. So I would predict those are going to be online and virtual for the remainder of this year and more. We already know that some of the meetings that are not waiting to fulfill insurance criteria have already canceled into next year. The news on other fronts, though, is encouraging. UW will be a part, starting immediately, with the major vaccine trial worldwide, the Oxford vaccine. That's a modification of a virus that is modified to carry the spike protein of the COVID-19, one of its unique features, with the hope that you would build antibodies to that spike protein, recognize it if you were infected, and eliminate the disease. The problem with this test is that it's a strategy that is not exactly proven. We know thus far that it does cause antibodies. Whether those are effective against the disease, this is what we hope to find out, and whether it's safe. That's a large trial. They usually take 4 years. They're actually hoping that it could be done in a matter of months. The most realistic people are thinking well into next year. The most political people are thinking sooner. We'll have to see what happens. But we'd be foolish not to understand that these events are governed by more than medical need. That's a good way to put it. The other good news about UW is that our space and ability to care for people. If you are in any way involved with the inpatient service, you'll know that we struggle every day to find beds to put people in. We're very, very busy. And that's without a lot of COVID hospitalizations. I think that this period of isolation has caused a lot of people to look to us who were open through the whole thing, and it continues even when the other hospitals are open, that they're really not doing major neurosurgery, and they're sending it here. And so our very good services are very busy, and we've long since run out of beds. 12 new beds will open in October, but they probably won't be staffed until November. And that will help, but it will in no way alleviate the entire problem. There are several other very good things if you're involved in the department. in that we have been approved that our residents will be housed right next to the patients where they belong, as opposed to in some remote site, so that as they do their work and they do their charting, they're readily available for emergencies. And the Plenty Room will be rebuilt into the new remodel in a staged fashion. The present Plenty Room will not be taken down until the new one is built. These are major victories in a world where we shouldn't be having to fight about such common sense things, but it's taken years to get approval for that. And I'm quite happy that that's happening. The other thing is, I'm really happy about this team and their ability to work even remotely or under unusual circumstances, and the ability to stay healthy. Our team is healthy, and the masks and the hand washing, I think, are going to decrease our exposure to flu this fall. That's what happened in the Southern Hemisphere. They really didn't have a big flu outbreak because everybody's attempts to mitigate COVID work against flu as well. And so I'm very optimistic about that. I'm optimistic that we're becoming more and more productive as the labs, anyone that has asked has been approved after modifications on reopening their lab and their clinical research in a new modern world that has staggered schedules, social distancing, sensible procedures, and I think that's been an improvement. We've improved our ability to care for patients with online. That's helped. I don't think the plethora of online meetings and conferences is a good idea, but the in-person ones, which were unnecessary, weren't a good idea either. So we'll take that as a plus and a minus. What we're saying is that we're living with COVID and we're doing a good job of it. And I want you to be proud of it. We're going to be doing this for a long time. I have to admit, it wasn't until like 10 days ago that the first time I was brave enough to go to one of these outdoor restaurants and sit under the umbrella in the parking lot or on their lawn or something. But I actually found that it was very nice. And I think that's what we're going to be doing for a while. And I think it's important because all those workers in all those restaurants need the jobs. I don't need the food, but I'm more than happy that as we begin to open things up, people are beginning to understand the needs and beginning to understand the needs of everyone else around us. And that brings us to this really troubling issue of social justice. I mean, it's close to home. People are, our anesthesiologist had someone down the block shot through their window and paralyzed just last week. Every one of us is having cars stolen or things broken into in every neighborhood in Madison. And there are these demonstrations and counter demonstrations of angry people. And really what it is just the stress of the COVID and the isolation, and in some cases the excuse, has caused people to really tear the scabs off of 1,000-year-old grievances and 1,000-year-old things about people that we must address, that we must do better with. And believe me, social justice is really the root of peace, of what we wish for all our families, for all our friends. And the way we do it is through healthcare. That's what we do. And advocacy of those people, they're called politicians, that are in a position to change things. And what we do is we vote. And I want people to vote. Vote as they see as proper, think carefully, do it. But also remember that what you do every day in healthcare is social justice. So I'm going to talk about that relationship of peace and justice by quoting, because I do like to use quotes, Paul VI, who said, if you want peace, work for justice. I think that kind of sums it up. And guess what? That's what you're doing. That's why I'm proud of you every day. And we're going to be okay. It's tough. It's tough times when we see our society in turmoil, but it's a wake-up call that we redouble our efforts. So I want to thank everybody for that. We'll keep this team together, we'll keep it funded, and we'll keep people working. And I'm proud of what you do. Thanks to all that you do. Thank you now. Bye now.